The spirit of the ADA is of access and inclusivity, a value shared by ODE and our employee resource groups. And that's why ODE is standing with ADAPT today. Since being designated Multnomah County's ADA coordinator a few weeks ago, I've been working with facilities and would like to take this opportunity in particular to acknowledge Sherry Swackheimer, who isn't here today, and specifically facilities' commitment to providing access for everyone. Bob Leake may be here on behalf of Sherry to support our effort. In particular, I'd like to highlight the partnership and support of Colleen Bowles and Mike DeBlasi of Facilities, and Mike is here. We're working together to weave various efforts within Multnomah County that have already been taking place for quite some time. And Colleen will be spearheading an effort to create a work group within Facilities to focus on ADA issues of compliance. This group is scheduled to meet for the first time in September. I'd like to introduce the co-chairs of ADAPT, Sherry Taylor and Tracy Buckner, to move us forward with today's proclamation.
Good morning, Chair Kafori and Commissioners. My name is Sherry Taylor, and I'm one of the co-chairs for ADAPT. ADAPT has been in existence now for a little over a year, and we're struggling for membership. I remember I was so excited when I first heard that Multnomah County was forming an employee resource group for people with disabilities and their allies. I remember the very first meeting here in the boardroom, the kickoff meeting, to discuss whether or not there was interest in this, and if this group was in fact necessary. That day we heard over and over again people talk about slights and negativity from co-workers and even their supervisors around their disabilities, and this was especially true if it was an invisible disability. We decided then and there that there was enough interest and that in fact having this ERG was very important. So why are we struggling for membership then? We saw that boardroom that day filled with people for the first meeting. But after that, I have talked with people and asked them why they have not joined. And I found that there are, although there are other reasons, the primary one is stigma. There is stigma attached to being associated with an ERG about disability. I've talked to other county employees, who have shared their stories with me. And one in particular that stands out told me that they have a mental illness and that if they in fact joined ADAPT and others found out about that it would be very troubling to them, that they would be looked at differently and that they could not stand that chance. So that's a big shame, and because disability is not inability, so it's clear there's much work to do and there's much in terms of awareness and education. Excuse me, I'm very nervous. But those two things are foremost priorities. I'm happy to say that Human Resources is present at most of our meetings so that they can assist us with things as they come up. We appreciate their support. So because we need education, and because there is stigma, and we try to incorporate some of the difficult, hard to talk about things in our meetings. At our next general meeting, for example, the topic will be mental health, perception, stereotype, and stigma. Not too long ago, several of us traveled over to OHSU to meet with their disability ERG. We told them that we were going to do this meeting about mental health. And even though they've been in existence a lot longer, they kind of said, wow, we haven't even touched that one yet. So the truth is, 1 in 4 people in the United States will have a mental health issue in their lifetime. So we feel we should talk about it, that it's important to do so. So speakers we have lined up so far for this meeting are Mental Health and Addiction Services Assistant Director Terry Beamer, Director of Human Resources Travis Graves. We also have a panel of mental health practitioners that will be there from OHSU, Kaiser Permanente, and Florida Health. The meeting will be from 1 to 3 o'clock on August 18th in room 315 this building. The takeaway from the meeting will be that mental health issues are not a personal failing, but they are a treatable medical issue. So we would like to extend an invitation to any of you to come to that meeting, to open it, to say a few words on mental health if you're interested and are able to do that. And at this time, my co-chair, Tracy Buckner, will just say a few words. Thank you.
Thank you.
Good morning. My name is Tracy Buckner, and I'm the co-chair for ADAPT.
I'm sorry, can you pause for one moment so we can get a microphone? We don't want anyone, any of our viewers, to miss a word of what you're saying.
I'm honored to have been asked to be co-chair for this employee resource group for people who have disabilities and their allies. We created the name for this group, ADAPT, which stands for Abled and Disabled Advocates Partnering Together. And we want to focus this group on the needs of employees who have disabilities and their allies as well. I know there are many employees that have invisible disabilities in the workplace, but often they don't realize how much they aren't able to become involved. And becoming involved, they can learn many new things. I myself learned many new things as I joined ADAPT related with disabilities in the workplace. I have met many different employees, been to meetings. I've also listened to those employees, their stories of struggles and frustrations. There's a lot of fear and shame there involved with coming out with a disability and sharing that disability with your coworkers, with your supervisor, management team. And there doesn't need to be. We have so much work to do to educate people in order to be more sensitive of others with disabilities and how to work around disability. We plan to have meetings with different workshops upcoming in the next month. Like Sherry mentioned, please do come to our meeting or discuss different topics with us. So I really want to thank you for your support for this ADAPT committee. Thank you, commissioners.